Hey, hello everyone. Good evening. Hope all of you are able to see my screen and hope all of you can hear me. Can I have a quick confirmation, guys? Can you guys hear me? Thanks, Mohanty. Thanks for the confirmation. All right. So where did we start? I think we have been discussing about the medical history, correct? This was the domain last week we have started. And if I'm not wrong, three of them we haven't discussed. That is, what is your end reference point? What is going to be end reference time point, and relative to the reference point. These three are the one we haven't discussed, correct? And also we had to discuss the examples for them, correct? So let's have a quick recap and we can proceed with this. So what medical history will do, the name itself is telling to you, it is going to deal with past medical history. So again, when you say past medical history, from when to when? It is generally before the treatment and after the subject has signed the informed consent form, correct? So what is this medical history primarily deals with? It can be of a disease information. What is the illness history of the patient? Has the patient or has the subject undergone any of the surgeries, or the patient met with any of the accidents prior to this ICF, correct? So all these things will be recorded in this particular domain, correct? So what is going to be the nature of this domain? The nature is going to be one record per medical history per subject, correct? So per medical history event, history means everything together. So each event we are going to record, correct? Then we generally discuss the topic variables. The topic variable is going to be MH term. So what MH term is going to tell you? The MH term is going to tell the detailed description of the medical history event. What is that event? What exactly happened? Then, what are going to be the identifier variables? Three identifier variables are common for almost all the domains. What are them? Study identifier, domain, unique subject identifier, right? So these three are the common ones. In addition to that, you're also going to have your sequence number. What is your sequence number? Within the domain, for each subject, we will assign one unique identifier. That unique identifier number, we will be call it as your sequence number. So generally, for each subject, we are going to have this particular sequence, correct? Within the subject level, we should not have any of the duplicates. So if you see subject 111, so 1, 2, 3, 4. Again, subject 2, 2, 2, I have 1 and 2. You can see that 1 is here, 1 is here. At a domain level, these are not unique, but within the domain, at each subject level, this sequence numbers must be unique. That is what we have mentioned here. Any numeric number, but it must be unique at subject level within the domain, right? So we just now discussed what is called your MH term. MH term is all about your medical history event. So here, if you see that the medical history event is nothing but either we call it as an accident or a broken leg or a fever, all this, correct? So two of them are the events, one is nothing but the disease here, correct? Then, so this is a normal one. For each of the term, there is a medical dictionary derived term. That medical dictionary derived term is stored in your MHD code. This is nothing but D stands for your dictionary, COD your code, correct? It is a derived dictionary code. So what is the derived dictionary? Who will actually maintain this? MEDRA, correct? This is a standardization, correct? So if you see the high temperature, we generally call it as fever. Not exactly the fever. We have something called last time Sanchi mentioned as something like pricks or something. I'm not able to recollect it, but there is going to be a medical related term, and those medical related terms we are going to store it here. Then we have MH body system, which is nothing but what is the body system or organ class we are talking about, right? So who is going to define this? This will be used by the sponsor either from the coding history, or sorry, either from the coding dictionary, or it is actually from the SOC. What is SOC? Standard of care. So who will use this and why the person will use it? The sponsor will use it for his own analysis and summary. Some of the examples are nerve system, ortho, oncology, like this. What is MHCAT? MHCAT is nothing but a category of the medical event. It can be general medical history, it can be ortho, it can be cardiac, all this. Correct? If you go with one more further or the deeper categorization of this, even further classification of this, which is nothing but your subcategory. Correct? Then medical history start date and medical history end date in your character format. That too, the format that we are going to use is 8IS 8601. Those will be your medical history start date and time, medical history end date. Then MHDTC. When you collected all this medical history, that date and time is nothing but MHDC. MHDY, your study day of collection, right? So it is a derived variable. Generally, we are going to use two things for it. What is going to be a reference start date and time in character format? This is part of your DM domain. When you collected your medical history, that is your MHDTC. Based on these two, we are going to calculate your MHD. Then MH duration. It is not a derived variable. It will purely talk about your medical history duration, the event duration. Correct? So who will give this? It is part of your CRF. If it is there in the CRF, as is, we are going to represent it. Then pre-specified. Some of the medical history events are already pre-specified in your CRF. So here only we are going to have two things, whether it is going to be yes or no. Stat. Medical history status. Either is it done or not done. Meaning, have you captured all the medical history events or not? Suppose if you have, then most of the time it will be done. If it is not done, you need to give the justification for it, why it is not captured. For that, we are going to use the another variable, which is nothing but the MH, reason not done. REAS is reason, ND is nothing but the not done. Okay, so first let's have a quick examples for this particular one, and then we can go ahead with the remaining three terms. Okay, so I'm just going with the medical history example because whatever we have discussed so far, let's go with them and then we will go with the remaining things. Okay, maybe I don't need to do this. Yeah, here it is. So if you look into this particular one, here study ID, domain, unique subject ID, all these you are aware of. Here I have taken only one subject. Only one subject. So my medical sequence starts from 1 to 5 because I have 5 events. Each 5 events, for each of this I have defined a sequence number. So MH term talk about what exactly is going to be the event, medical history event that was happened. Asthma, frequent headaches, broken leg. Then you have your stroke here and you have your CHF here. What is the equivalent medical term from the medical dictionary? Asthma remains going to be the asthma. Frequent headaches, you are calling it as headache. Broken leg falls under bone fracture because all the whatever, let's say broken hand, broken leg, or anything related to this will be part of your bone fracture. And here you can see that here I have ischemic stroke, but this particular one is not part of your dictionary yet. You don't have the relative term there. Since you don't have the relative term, you can see here it is blank. We don't have the term for it. Okay, CHF, cardiac failure congestive. So we have the equivalent thing. And category, I told you category is all about what is going within, under which category it falls under. And you can see here most of them are the general medical history. You can see asthma, headache, broken leg. These are general medical history. Okay, but when it comes to the stroke, right? So it falls under your primary diagnosis. The category is primary diagnosis. And here CHF, cardiac failure congestive, it is going to be cardiac medical history. Again, under this medical history, if you see that, your asthma, it is all about your respiratory system. So the subcategory is going to be respiratory. Broken leg, simply we are mentioning as other. Your headache, we are calling it as a MS. Maybe it falls under the nerve system as well, right? And you can see that the status I have not mentioned here yet. Maybe in this example, status is not related. I just delete this. I don't need it. Anyways, I haven't mentioned why unnecessarily we need to put this. Okay, so this is nothing but body system or organ, right? So this is respiratory system disaster. And you can see that central and peripheral nervous system disorder. That's what we talked here, right? This is going to be related to the muscle, right? Related to some muscle. So disorder. And since this particular one, we don't have the proper reason, so proper thing. So we just have not mentioned about this in your article. Cardiac failure, cardiac arrest directly. All right, and then these two we talk little later. Right? So this is nothing but medical history, start, date, and time, right? And you can see that when the stroke happened, we recorded. When your cardiac failure congestive happened, also we recorded. But can you see these two? These three, the first three. The first three, we haven't given the start date. We haven't given the start date. The reason for that one will be, why we haven't given the reason for that is, it is pretty simple. These are ongoing events. Or this bone fracture happened long before, long before, right? So generally we capture the events from the ICF2 before the treatment. Generally, am I correct? So in this particular case, we haven't captured this particular one. For the third one, it happened long back. But these two are ongoing, meaning the subject get this because it's a frequent headache. The person is getting this headache frequently. So it doesn't mean that it is not going to end during our duration. It will continue. Asthma. So whenever you have some dust allergy, or whenever you have some, sharpness of the breath, or whenever you have some congestive, when you are part of some, congestive rooms and all, in that particular cases also you're going to get it, right? So these are ongoing events. That's the reason we haven't captured your start date time. Am I clear? So anyways, these two we talk a little later. We do have a different example. We haven't discussed these two, right? So what is your end reference time point and what is going to be your relative end reference time point? We haven't discussed this yet. We are going to discuss this and I'm going to explain this. Is that clear up to this? Because we have discussed from here to here. All these terms we have discussed, from D to J we have discussed. So that's the reason I'm going to show, I'm showing you the relative examples. And I have also given the comments. All of you are comfortable up to this? Can I have a quick confirmation from everyone? Do you have any follow-up questions or any related doubts here? Anyone? Any questions, team? All right. All right. I consider no. Then I'm proceeding with the next example, because I also talked about status and the reason for not done, right? So for those two, I'll give you the another example. Can you see this? Here, let's go with these two. So there are two subjects I have taken here. This is subject 1, right? Ending with 2. Here is the another subject ending with 3. Right? So both of them has pretty much similar terms, the same terms. All the medical history events are same for both the patients. And here you can see the pre-specified. All of them are pre-specified in your CRL. All of them. And here you can see the occurrence, medical history occurrence. You mean to say whether these will be the occurring events, right? If it is documented, right? If it is documented, we are going to document them in the occurrence. Meaning, this one is going to be artery disease. Here is going to be heart failure, right? And then you have peripheral vascular disease. These are not repetitive ones. Heart failure will not repeat. Once done, it's done. Correct? These are not the repetitive ones. So that's the reason we defined, or the sponsor defined them as no in your CRF. Asthma, pretty much a repetitive one. Correct? It is a pretty much a repetitive one. So because of that particular reason, we mention this as occurring. And for this particular patient, you can see the artery one is repetitive for this particular patient, right? He mentioned that it is a repetitive thing for him. So during the time of screening, all this will happen during the screening, right? During the screening, this particular subject mentioned that this artery disease is going to be repetitive for him. There is a chance of occurring again. So it is mentioned as yes. But for this particular guy, related to the asthma, all the details are not collected. It is not collected properly. That's the reason you can see that the MH stat, the status is not done. If it is done, we don't mention it as explicitly done. Only when it is not done, we will enter the status as not done. And then the moment it is not done, we need to mention what is the reason. The person who is taking care of the screening have not asked this information, forget to ask. Then that's the reason you don't have the reason for that, and at the same time we don't have a clue about whether it is an occurring event for him or not. Make sense? And you can see the reasons also here. The question regarding asthma was not asked, so that's the reason MH stat is used to indicate and MH occurrence is null, right? That's the reason I just mentioned all these three here as number one. Clear, guys? Remember, all these are happening during the approach. That approach is going to be a screening. All right, let's move to the next one. This one I haven't explained to you. Let me explain this and come back on it. Maybe I can explain directly here. See, here also the same patient, only one subject I have taken. There are 8 different events, that is 8 different terms happen. Like I can say that asthma, frequent headaches, broken leg bone, ischemic stroke, yeah, diabetes, hypercholesterolemia, hypertension, and TIA. The relative medical dictionary codes also here. Category is general medical history, and subcategory is also available here. Nervous system, other, and respiratory system. Whether pre-specified or not, yes. If it is pre-specified, what is the occurrence level? Both of them we have mentioned. Body organ or your body system mentioned. Start date is mentioned only for one, for the remaining we have. Now let's talk about these two. So there are two things. Number one, end reference. This end reference period will be defined by your sponsor. It has a start time, it has an end time. So between the two discrete periods, the sponsor is going to define this particular period. So the reference to this relative period we are going to talk here. Now, if you see this particular one, first one, asthma, maybe easy ones, that's the reason I'm talking about this here. Let's go with the first one. First of all, who will define this? Where it will be defined? It will be defined in your CRF. What is that? It will be defined in the CRF. Okay. In the CRF, where it will be defined? There is a question called ongoing at study start. What is that? There is a field in your CRF called ongoing at study start. It is going to have two things. That is, the question is going to be ongoing at study start. This is as part of your screening and it is part of your CRF. There will be two fields populated for it. Sorry, there will be two answers populated for it. Either yes or no. Meaning, if it is marked as yes in your CRF for this particular question, meaning it is an ongoing event. What is that? It is an ongoing one. The reference is ongoing. Is that clear? If it is no, for an example, if it is no, this event already happened. It happened past. That is, before your medical treatment, it happened. So it will be before. So there are two things. What are them? So when this particular event is going to happen, sorry, when you are going to capture this? During the screening. So during the screening, while preparing your CRF, you are asking a question. What is this particular question? So what is the medical history event related to this? In your CRF, we mentioned that yes. The meaning is whatever we are talking about, this medical history event is an ongoing event to this particular subject. It already happened to him. It may happen during the screening. It may happen during our ICF. It may happen even after the treatment. It may happen during all phases of your clinical study as well. Example is asthma or simple take headache. The patient is facing frequent headaches. Let's say a patient arrived to the screening on, let's say today, 16 May 2022. It doesn't mean that this particular guy haven't get headache prior to this. Because it's a frequent headache. What is the meaning? He might have headache one day before. He might have headache 10 days before. He might have headache 10 years prior to this. Am I correct or not? Or 1 month prior to this. So what I'm trying to say, the headache is the one which is a frequent thing for him that happened before the study, that might happen during the screening. I came for the screening. Now my screening is happening from 9 p.m. to 10 p.m. but I'm having headache now. Chances are there. Okay, I signed the ICF, randomization done, treatment started. That is nothing but study drug is started giving to me. So let's say that I'm in the phase 2. So in phase 2 it can happen. In phase 3 it can happen to me. Even during the follow-up also it can happen. Correct? So what is the meaning? This event is an ongoing event. So your end reference time point is going to be ongoing. It is an ongoing event. Then what is the period? The period is going to be during or after. That is, during this medical history collection it can happen. Even after the treatment also it will happen. So the controlled terminology to represent your MHENRF, end reference to your period, is going to be during or after. Your time point is going to be screening. Your time point is going to be screening. All of you are able to understand this, what I'm trying to say? Can I have a quick confirmation? If you look into this, you can see here I have already given end relative to the reference period. Who will define this particular one? This is going to be the end of the relative event, which is defined by your sponsor. Your sponsor is going to give the starting and ending point. For that particular one, what is the reference? That is called your MHENRF. Correct. What are the various things for it? So there are two things. Control terminologies are going to be here. What are my controlled terminologies? So let's say for things like asthma or things like your headache, these are during or after. It is happening now, it may happen in the future. Things like accident. Accident happened already, right? My leg got broken already. and I got recovered from that particular event. It may happen after my treatment. Maybe if I go outside again after my treatment, maybe for some reason it may happen. But during the treatment, during this particular treatment, I'm in a safe and secure zone. I'm within the hospital. I'm within the study center. Correct? I'm within the medical college where this particular clinical trials are happening. So since it's going to be most of the time a secure and safe thing, there are no chances that, or there are going to be very limited chances that I met with an accident again. But this happened already, right? That's the reason we are recording, right? So here the control terminology is going to be before. Since here the fracture happened, my leg got broken, but when this got happened, it happened before to this particular one, not today, right? So that's the reason my end reference for this particular duration is going to be before. Is that making sense, guys? For a headache, it is continuous one. It may happen again. During my clinical trials also it will happen. So I'm just mentioning this as a during or after. Asthma, same thing. But when it comes to fracture, it happened long back, right? It happened before. So my end reference period is going to be, end relative to the reference period is going to be before. Is that clear to everyone? Can I have a quick confirmation? Right? Now, the equivalent period, the time point to this is going to be the reference period. Now I'll talk about the time point for this, reference time point for this. This reference time point is going to be either ongoing or it is before or it is after. Mostly it is going to be ongoing or before. Like things like headache and asthma, it may happen, it already happened, it is happening. So it is going to be an ongoing event. Something like a fracture, it already happened. So I'm just calling it as before. Is that making sense to you, all of you? I have given the details also here, you can see. All right. Any questions on this? All right. Now we come back to this. Here you can see the time point. This time point, that is ENTPT, this will be when exactly it happened. That is when it happened. You can see. End reference time point. Generally, it is going to be a screening time point. Right? It is just the end reference time. Clear, guys? Three simple things. All are going to be like some reference to the event. If it is an ongoing event, you are going to mention the time point as ongoing, record the time, that is your IS 8601, followed by, to represent your relative to the reference period, either you are going to call it as a before or you are going to call it as during or after. All of you are comfortable with your all the points at the same time? Are you comfortable with your examples that are provided here? Can I have a quick confirmation from everyone? All of you are clear with us? If yes, I can wind up this, guys. I mean to say, I can close this medical history. Anyone, any questions? All right. Let's, we already at 9:10. Okay. What we can do is, let's take a simple one. A simple domain we can take, which we can complete in less than 20 to 30 minutes and we can proceed. Okay. And such simple domain is going to be a protocol deviation domain. It is a very simple domain which is having a very limited, I can say that hardly less than 10 or 12 variables will be there. Let's quickly discuss them and we can close the session for today. Okay, it is also part of your events. That's the reason we are discussing this. A very simple domain, and the name of that particular domain is going to be protocol deviations. Even though it is a protocol deviation, guys, we are going to call that as DV. It is going to be a DV is going to be a domain. This is the one. So protocol deviations domain. All right, let me save this and we can continue with our discussion. So this is a very simple one, guys. That's the reason we are proceeding with this. Hardly, I can say that 10, less than 10 or 15 variables. Okay. Why we need this? What is the reason? What exactly it is going to capture? The answer to this is going to be, the intent is to capture only two things. Only two things. Those are, one, protocol violations. Guys, there is a small difference between inclusions and exclusions versus your protocol deviations. Inclusions and exclusions are going to be what are the things we may include or we may exclude. This will be part of your protocol itself most of the time. These are violations. I mean to say, you're supposed to do this, but you're not doing it. As per the protocol, you're supposed to do this particular. Let's say you're supposed to take 5 mg of the drug, right? But what you did is, instead of 5 mg of the drug, let's say you have taken a 10 mg of the drug or 2 mg of the drug. So that is a deviation from what is mentioned. Let's say during this particular treatment, you're not supposed to take aspirin. Let's say that you're not supposed to take aspirin pill, but you have taken. It is a violation. Either it can be a deviation from what is defined, or it can be a violation from what is supposed to do. From there, you got violated. All right. So when it happened, the intent is to capture the protocol violations and the deviations during the course of study. Am I correct or not? Only during the course of study. During the course of the study, what are the violations that are happened, right? And what are going to be the deviations that are happened? Main thing you need to understand here is, it won't capture, main thing, remember, it won't capture a response to each violation and deviation, right? It won't look at the what is going to be the response for the violation or deviation that are happened. I'm least bothered about it. I only capture what happened there. I don't need the response of it. I don't record the response of that particular one. Am I clear? This is very important. Why it happened, what is the response to this particular one, what happened after this. No. What violation happened, what deviation happened, that's it. Is this clear to everyone? A most important thing. Typically, right, typically what it is going to do, events, what events it is going to capture, include what is the event. Now, typically what it includes, typically includes few things. What are them? I'm going to mention. What is the event, right? Second, when it happened. When it happens, it is going to capture start and end dates. That's it. Mostly it talks about only these two. What is that? What is the event? What is the protocol violation happen? What is the deviation happen? When it happened. That's it. Main thing. Right. Okay. So generally, when it is going to happen to you, because we talked about when it is happened, right? So when it may happen during the course of study. So generally, deviations, I can say that usually these deviations occur after the randomization. After the randomization. Why randomization? Remember this? After the randomization only, you will be populated under two things. What are them? Either you will be provided with your placebo, or you are going to provide with your original drug. Remember this, right? There are going to be two groups, right? After the randomization only, you are going to fall under those groups, correct? So usually these deviation occurs after the randomization or after receive the first treatment, because you receive the treatment, after that you are going to have, let's say, some headache, right? You got some headache, or you got some nausea, or you got some vomiting sensation. The moment you get it, you tend to take the pills to compensate it, correct? But let's say that in your protocol it is mentioned that you are not supposed to take the pill, but you are taking it. What is the meaning then? The deviation happened, violation happened. Let's say you're feeling dizzy right after you're taking the medicine. Your clinician mentioned that you're supposed to take 5 mg of the treatment study drug. But what you feel is morning when you take this particular pill, you feel dizziness. So again, you need to supposed to take this particular drug by evening. While taking it, instead of taking the 5 mg, you take only 2 mg. Why? 5 mg is making you to feel dizzy. You want to come out of that. You don't want to feel dizzy. So you've taken the lesser dosage. Deviation happens. Correct? All these will be recorded. Right? Remember, the deviation domain is for more general deviation data. Remember this, more generic deviation data. Clear? All of you are comfortable with this, whatever we have discussed so far? What it is going to store, typically what it will deal with, what kind of data it is going to record. Right. So let's talk about the nature of the domain. It is going to be one record per protocol deviation per subject. Remember this, these should be on your fingertips. It is going to be one record per protocol deviation per subject. Right. So we generally talk about the topic variable, right? Can someone guess what is going to be the topic variable here? Generally, these are all events, right?
Protocol
For
number.
no. See, topic variable is nothing but it should focus on what is this domain is all about. Am I correct? Exactly. Exactly. When it comes to the adverse events, it is going to be AE term, right? Then the name of the event. When it comes to your previous domain, medical history, it is MH term, medical history event name, correct? So here also it is going to be the same. It is going to be DV term, right? All those, remember this, even we discussed this in one of our domains discussion, right? Initially when we start with this, for all the events, I just mentioned like this, XX term. This XX is going to replace with each of your domain name. This is what I mentioned. Remember, same thing, right? For all the events and all, it is easy to remember. It is always going to be a term, XX term. XX is going to be a domain name. So let's talk about this DV term little later. First, I'm writing this here. We'll discuss this at the top. What are going to be our identifier variables? We have identifier variables, right? So the identifier variables are going to be generic. For this, I just want to do a copy paste because it's almost a repetitive one. So your identifier variables are going to be study ID, domain ID, as well as your. So up to this, I can simply copy paste because these are going to be repetitive ones. What are them? Study identifier. It is mentioned in your protocol. Domain abbreviation, a two characters long, which is going to be for your protocol deviations. It is going to be DV. Unique subject identifier, it is always going to be a concatenation of 3 different variables: site ID, subject ID, and study ID. You have the next variable. Let's start with this particular variable, and that variable is nothing but your protocol deviation sequence number. Any numeric, but it must be unique at the subject level within the domain. The same thing. Let's say you have your medical history sequence, you have DV sequence, correct? The same thing, the sequence numbers are going to be the same. All right. So let's talk about your term first. From there, we can continue with our discussion because it is going to be the topic variable, right? DV term. What is DV term again? Can I copy from here? Nothing wrong about this, right? Right? Small changes will come. I'll talk about the changes now. The name of the event, there's no doubt about it. It is going to be the name of the event, but it is not exactly the event. It is going to be name of the protocol deviation. Am I correct? Protocol deviation criterion, or simply you can just name of the protocol deviation. Okay. Or as per your implementation guide, if you want to talk it, it is going to be protocol deviation term. Anything, name of the protocol deviation or deviation protocol term, anything you can talk about it. But remember this particular most important thing, this is very important, that is, as is whatever is mentioned in your CRF or whatever is mentioned, we are going to use it as is. As is, we are going to mention it. And other thing, maybe if I'm asking about the, maybe I can say, let's say DV, right? Let's go with the DV, maybe DV. Let's go with the only one patient. Instead of AE, it is going to be DV. Instead of AE term, it is going to be DV term. Okay. Now, so the DV term is going to be different, right? It is not a disease, or it is not a drug, or it is an event. It is actually what deviation that is happened. We need to write the complete details there. So it is, let's say that it is going to be IVRS process deviation. In IVRS process, there is a deviation happened. What is the deviation? No dose call performed. So there is going to be a dose call every day, but the dose call was not performed. So you have to do the complete details. All right. This is nothing but violation. For an example, let's talk about the deviation. Let's say took prohibited drug, right? Or let's say that took aspirin. What is this aspirin drug? Why? Why it is a, why you are talking about this? It is a prohibited drug. It is a prohibited drug, but you have taken this, which you are not supposed to take it, right? There is a deviation. There is going to be a dose call. How much is the dosage? But you haven't mentioned about it. So these are going to be the two deviations happen to this particular subject, and we are capturing it here. Am I clear? What is called your DV term is? Most important thing that you need to understand here is always the DV term, these values will map to the controlled terminology. So we have some control terminology, right? Because this is going to be a very big name, right? So there is going to be a control terminology for this particular one, a standard term we are going to use it, right? And those are stored in a variable called DV decode. So you remember, right? What is DV decode? Is nothing but a dictionary derived one, a standard one, right? That we are going to discuss now. So what is this DV decode is? So the DV decode is all about protocol deviation coded term, or it is going to be controlled terminology. It is going to be controlled terminology for the name of the protocol deviation. Whatever the protocol deviation happened, for that particular protocol deviation, right? The controlled terminology. Okay, what are going to be the examples? Or what are going to be the examples for this? It can be like subject not, maybe selection criteria not met. anything, selection criteria not met, right? There is going to be a treatment deviation. Maybe if I take the previous example, this example itself, if I take this here, maybe I can write this. So what exactly happened here? If this is going to be called it as your DV term, then your DV decode is going to be the dictionary derived one is going to be. For both of them, it is a deviation, right? It is a deviation. So the deviation is the one that I'm mentioning here as a DV decode. Remember, all of you are able to understand this? What is the event, the name I'm writing in the DV term? What is the control terminology, or what is the standard term that I want to use it? That standard term I'm mentioning under the DV code. You can also write this here. If I want, you can also give here a standardized term. Standardized. A standardized term to capture DV term. So DV term is more of a description. Instead of a description, if I want to give some standard term to that, that standard term is nothing but a DV code. Okay? Questions? Is that understandable, guys? Very simple one. That's the reason we are just going on a little higher pace. Okay? Now, DV ref ID. The name itself is telling ref ID is nothing but a reference ID. Who will provide this? This reference ID will be provided by a sponsor. It can be either internal or external identifier. We discussed this even in the this one, AE also. If you remember, there is going to be a AE reference. Let me show you some examples here. Here it is. Let's see. Reference ID, internal or external identifier, such as serial number on your serious adverse event. There it is an adverse event that you are going to write it. Here, any reference thing, either it is going to be results in death, life-threatening, all this. Almost the same thing you are going to use it here as well. Okay, then the similar one, I'll search for one more thing here. Yes, can you see this? Sponsor defined identifier, correct? The same thing will come here as well. You call that as a DVSPID, sponsor defined identifier. It is not a derived one. It will be as is available in your CRF, or it will be defined in your sponsor's operational database. Okay, what it is going to be? Line numbers in your CRF page. Simple. It can be a line number. Sorry. Right? It can be a line number, or it can be like whatever is defined in your sponsors database. Since we already discussed this in detail in your adverse event, I'm simply copy paste that here. Okay. Then same a few more if you want to talk about it. Here I have category as well as your subcategory. Correct. The same thing will also come here. Category of your protocol deviation. Maybe I can copy that from here. So it is going to be a category of your protocol deviation criterion. All right. So it is going to be like related records. You are going to put it here. Okay. Maybe this is not related here. That is nothing but your bleeding and all will not be part of this. So I'm not using the same example. So again, this is going to be further categorization of your protocol deviation criteria. It is further, if I still want to classify it, what it is going to be. That is nothing but your DV subcategory. Okay. Then we have just three more variables. The three more variables are nothing but your what is your DV SDTTC. The name itself is telling it is going to be start and date time. Correct? start, date or time of deviation represented of deviation. Generally, we are going to how we are going to put this particular one. It is going to be put it in the character format. And what is going to be the format? IS8601. Either it can be DA or it can be DD. Simply, if I want to tell it Murli, even I don't want to go with this one. Simple. Can you tell it in a simple lineup? Yes. Protocol deviation start date. That's it. It is going to be a protocol deviation start date. The same thing if I want to put it in the end. Here. It is going to be protocol deviation end date. It is going to be end date and time of your deviation. Same character form. Done. Last variable, epoch. What is epoch? What is epoch? It is going to be start, date or time of the deviation. When this deviation happened, when this protocol deviation is happened, that we are going to write it. Simply, you can say it as it is going to be like, yeah, during what phase of your trial it happened. What phase of your trial it happened. For an example, if I want to give simple example for this particular one, I can write like this. It can be like under the treatment phase, right? It can be happened during the screening. These are nothing but your stages of your clinical trial, right? It can be happened during the follow-up. It happened at any phase of your clinical trials. Those details will be given under your protocol deviation. Clear, everyone? That's all. The total number of variables are happened. Done. It's done. So how many variables we have here? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13. Just 13 variables in the domain. Very small domain. DVSEQ. Sequence here we talked about. Mohanty, what I missed here? Mohanty, have I missed anything? No, right? Yeah, it is there. It is there. I mentioned at the top itself. Maybe you can take simple example. Maybe yeah, here it is. Take this particular one. So I have only one subject, disposition, your protocol deviation domain DV, unique subject identifier, sequence. 1, 2, 3 subjects, right? So that's the reason for sequence for this is 1. For sequence for the second subject is 1 and 2. For the last subject it is going to be 1. Can you see the DV term? IVRS process deviation, no dose call performed, which is categorized as the related standard term for this is treatment deviation. I can see this particular one. Visit 3 dose which is less than 15 mg. Treatment deviation. These two are nothing but your protocol deviations, right? Take this particular one. Drug triplex administered during the study treatment period. This particular one is excluded actually. You are not supposed to take this particular one, but the subject taken a prohibited drug. So it is going to be excluded concomitant medication. The same thing here. This drug, he is not supposed to take this particular one, but he has taken this particular. So where it happened, all these happened during the treatment phases only. All this happened during the treatment phase, right? That is your start and date periods are mentioned. A very simple way of representing your protocol deviation domain. So under the events, guys, we just have 2 more domains. Let me show that to you. Oh, sorry, just give me a second. If you see this particular one, all the special purpose domains are done. Main things, right? Demographics, Subject elements, subject visits, and comments. Done. 4 are done. Then these are general observation classes. We started with the events. Under the events, adverse is done, protocol deviations are done, medical history is also done. Correct? So what else are pending here? We have something called clinical events, right? One. So clinical events, disposition, and healthcare encounters. So these 3 are pending here. Correct? So let me show you what we need to discuss after this. So what we do is tomorrow and day after, I think 2 days are more than sufficient to complete your remaining events domains. These are little, I can say that time consuming one, because clinical events will take time. There will be so many variables. See this. There are more variables, I can say around 22 variables will be there. So it definitely take time. And what we have completed here, adverse events is done. Clinical events we need to discuss. Yeah, here it is. Adverse is done. Clinical events we need to go with. Clinical events, disposition, and healthcare encounters. Let's go with clinical events and disposition. These 2 are main things. So let's complete that mostly in 2 days. Tomorrow and day after tomorrow, we will finish that. So once we've done this, I'll go with the coding for your AE, because events and all together we can go. And for the remaining, I'll share you the data sets so that you can work on it parallelly. That is one. I also want to discuss something. What is that?